Infant mortality rates and maternal care are a major cause for concern in our country, especially in communities with low average incomes that are in rural areas or communities of color. But in Fort Worth, Texas, local leaders, nonprofit organizations, and the hospital systems are coming together with new and effective solutions, creating a template that can travel across the country. Our Mireya Villarreal is there for tonight's Prime Focus.
This is Fancy, Anya Mayberry Wallace's miracle child, a preemie baby that almost didn't make it.
When I found out I was pregnant with Fancy, I was actually going through a clinical trial for kidney disease. When I went into labor, it definitely was not as gracious as my previous labors. It was quite rough to where I actually lost consciousness halfway through my delivery.
And your husband had to decide?
He had to make a very quick decision between me and one of our children.
That moment was when Anya and her husband decided their fifth child was their last. But while she was seeking treatment for her kidney disease, she found out she was pregnant. Doctors warned she may not survive the pregnancy and suggested she consider terminating for her own safety. The recommendation was made just a few months before new, more stringent abortion laws were passed in Texas.
What was your biggest fear?
That I would leave my husband alone with my children if he wasn't prepared. And that is kind of what ended up happening. I went into very early labor at 21 weeks due to organ failure and had to have an emergency C-section. While having an emergency C-section, I went into cardiac arrest on the table. They were able to revive me, but I was out for 2 days. It was shocking, to say the least, because she was 12 ounces, literally the size of a soda can.
Fancy spent months in the neonatal intensive care unit while mom tried to heal physically, mentally, and emotionally.
It was overwhelming because I was struggling with breastfeeding, trying to still be present in what was going on with them and even our older children. And I felt like I didn't have time to reach out for help.
On the brink of a breakdown, Anya made time to get help, but not everyone is as lucky. Especially in Fort Worth, Texas, where infant mortality rates have been an issue for years.
When I moved to Texas, I very quickly was told that there's, this zip code 76104 that just has these bad outcomes.
Fort Worth sits in Tarrant County, Texas, the fourth highest in the state when it comes to infant mortality rates. The zip code 76104 is made up of low-income and predominantly Black families. It's less than a mile from several hospital systems, and yet they have the highest infant mortality rate in the United States, with 19 deaths for every 1,000 live births. It's a problem neighboring Dallas County is seen as well, forcing local leaders to face the problem head-on.
Especially for Black mothers in this country, that in many areas across the United States, it is more dangerous to have a baby today than it was in the 1950s and 60s. Returning to a more community-led approach where mothers never feel alone, that their infants are cared for. This needs to be a systemic change in the way we care for women and children in this country.
Mayor Parker forged a coalition to figure out how to save more babies and their mothers. It includes local hospitals, nonprofit organizations, and the TCU Burnett School of Medicine.
What is very simple in concept is giving an iron pill every day to every pregnant mom. Pennies a day, 1 pill a day, decrease transfusions by 1/3. That's profound. There are very few things in medicine that we can do at that cost, that simplicity, and make that big of a difference in the health of any patient, and in this case, in moms.
Through organizations like the United Way, iron pills are being delivered to moms in need all over North Texas. The coalition is also working to create a more holistic pregnancy plan that focuses on postpartum care, but can start the moment a woman finds out she's expecting.
Up until our 20-week anatomy scan, everything was great. We went into that sonogram appointment and they found a couple of abnormalities. We've got her social security card, cute little bows that I bought with her.
And so we decided to do an amniocentesis. That test was the one that we needed to really understand what was happening, what was going on.
The genetics counselor reached out to us, kind of explained the situation. They say babies with trisomy 13 have a shorter lifespan. They may not survive birth. They may be born still.
Despite the diagnosis, Yvette No carried baby Zoe to term.
We wanted to meet her. We wanted to see her. We wanted, the kids to meet their sister. Zoe lived for 36 hours, and we were able to take Zoe home with us, and it was one of the best decisions. And then shortly after, she passed away.
The No family was able to get through one of the worst moments of their life, they say, because of the ecosystem now being built around families. It starts with early intervention, but can continue well beyond birth if a mother needs it.
The OB checked on me regularly. Dr. Wyman would catch up. Do you have any questions? Feel free to contact us. I had so much support. And yet every day of my pregnancy leading up to when Zoe was born, 20 weeks plus 20 weeks to 37 weeks, I cried almost every day. And that's with the support I had. I can't imagine someone going through this alone and not having that support that we had.
Some of the biggest challenges for medical systems and organizations include rebuilding trust with communities of color and creating access to all types of medical care.
You don't want it to be too high, you want it to be completely covered.
Grant money is helping mothers in North Texas connect with a local doula program, pairing volunteers like Letitia Green with mothers-to-be.
I was a young mother. My first birth was at the age of 14, and so not having that type of support around made me want to get involved in this work.
Chantel Atkins had access to basic health care, but needed more resources and support.
What made you most nervous about being pregnant?
All these stories about some women that don't make it, that their children don't make it. Having her there to ask the questions and give me the guidance and to just mentally prepare me for the birthing process.
It really left an impression on you to the point where now you're talking about wanting to get trained as a doula.
Yeah, I would like to give back the same way that someone gave to me.
So we're gonna start with these.
The hope is to create a template right here in Fort Worth, Texas, that can travel across the country.
If we can do it in 2 counties with 5 million people, every community ought to be able to do this.
Helping families in some of their most vulnerable moments.
Motherhood has to exist. And in order for it to exist, we have to have programs like this in place that are effective and consistent in doing this work.